So have you been clearing your throat or coughing? You don't know why, but have no heartburn? Well, did you know that actually those symptoms could be due to what's called silent reflux? Oh, I know, the silent but irritating problem. Millions of people suffer from silent reflux and they don't even know that they have this. In today's video, I'm going to discuss exactly what is silent reflux. I'll give you 5 points I want you to know when it comes to silent reflux. And at the very end of the video, I'll give you my recommendation on my workup as a Mayo Clinic trained GI doctor when it comes to diagnosing and treating patients who have silent reflux. Guys, let's talk about food. Howdy, I'm Dr. Islam. I am a board certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating thousands of patients with silent reflux successfully to get their symptoms taken care of and get them feeling better. If you haven't already, don't forget to smash that like button, like, share, and subscribe. You can see Islam Gastro for all your reflux and GI needs. So silent reflux is exactly what it sounds. It's heartburn without the heartburn symptoms. So you actually have acid that goes up into the esophagus to cause other symptoms besides the typical symptoms of reflux, including heartburn and regurgitation. Now, these symptoms include throat clearing, coughing, feeling there's a lump in your throat, asthma, even ear infections as well. And so even though you may not have typical acid reflux symptoms, you may have the manifestations of too much acid going up to the esophagus to cause the symptoms like silent reflux. Here are 5 points I want you to know. Point number 1, silent reflux is weird. It really is weird. It's like this sneaky little burglar that's hanging around in your body and all of a sudden manifesting in weird symptoms. It's not your typical acid reflux symptoms. So it's not heartburn, it's not regurgitation, it's chronic cough, it is throat clearing, it is feeling like there's a lump in your throat. And all this is due to the annoying acid that you don't realize that you have. Point number 2, here's the tricky part. It doesn't burn like normal reflux. You may feel something right here, but you may have been told it's allergies or postnasal drip or nasal congestion, when actuality it's that acid that's causing the problem. Same thing with asthma as well. That acid goes into your lungs to cause asthma symptoms to occur, even though you don't feel that actual burning that's there from typical acid reflux symptoms. Point number 3, there are a couple different ways we can diagnose this. So one is that we want to get the right clinical history. So we want to rule out obvious reasons for your symptoms. So we do want to get an x-ray to rule out any lung infections. We may do testing to see if you have COPD or asthma. We actually may do allergy testing for allergies as well. But if all those are negative, then the diagnosis may be in your gut to find out what is going on. Point number 4, there's a workup that we do to see if you have acid reflux. So one of the first things I recommend is that we actually put you on a trial of an acid medication to see if these symptoms feel better. I know when my patients come to see me for chronic cough sent by their allergists, they're like, why am I seeing a GI doctor for cough? Well, maybe because it's that cough is due to acid reflux going into your lungs. So one of the first things I will do is I'll put you on a trial of an acid medication. I want you to take it consistently for at least 6 to 8 weeks to see how you do. If your cough gets better on the acid medication, boom, I have the diagnosis, you have silent reflux. If your cough does not get better on the acid reflux medications, you may not have silent reflux, so we may do further testing. That involves maybe taking a look with an upper endoscopy to see if there's any damage in that esophagus, or to see if you have any manifestations of chronic acid reflux like esophagitis or even Barrett's esophagus. And sometimes we'll actually do pH testing as well to objectively measure how much acid goes up into the esophagus. Do you have abnormal amount of acid going up that you don't feel, but it's causing those symptoms to occur? Now, managing it can be pretty simple. Once again, sometimes some lifestyle changes can help out, whether it's avoiding late night meals, not laying down as soon as you go to bed, avoiding the trigger foods, doing a trial of an acid medication and therapy for a couple of months. These are simple things that we do in the medical field to determine, do you have silent reflux or not? Plus, sometimes cutting out spicy foods and citrus foods, this actually may be the real troublemakers of why you have silent reflux. Now, silent reflux over time can lead to serious complications, including cancer of the esophagus, inflammation of the esophagus, and narrowings and structural damage. And so if you feel like you have issues like this, make sure you don't ignore these symptoms so we can find out the root cause of what is going on. Look, if you've been clearing your throat all the time, you're like, oh my gosh, what is going on? Come see someone like me where we can determine if you have silent reflux or not, so we can get down to the root cause of what is going on and get you feeling better. If this sounds like something like you experienced, hit that like button, let me know in the comments, and come see Slept with Gastro. We can find out what's going on and get you taken care of.